Hi everyone, Elle Adams here. I am the ambassador for Fowler Syndrome UK, and today I am here in Queen Square to see the wonderful Caroline Selai to talk all things Fowler Syndrome.
Well, thanks ever so much for coming to Queen Square Institute of Neurology here, Queen Square, London, in Bloomsbury on this lovely day. My name's Caroline Selai. I'm a psychologist and I work here both at UCL Institute of Neurology and also as a psychologist in the clinical department of neuroneurology. And I've been working for quite some time now with patients or people with Fowler's syndrome. And as a psychologist, my main message is that we have a lot of things that we can help with, and I very much hope that people with Fowler's will feel that they can come along and talk to a psychologist. What is quite interesting though in the clinical situation, in my experience, is that some people are a little bit hesitant, perhaps a little bit reluctant. They've had some perhaps challenging experiences with healthcare professionals. But my message is that there's a lot that we can do, and so I very much hope that anyone watching this will feel empowered and enthusiastic and come along and talk to a psychologist or indeed a therapist.
Hi everyone, I'm Elle Adams. I'm a content creator and I'm also the ambassador for Fowler Syndrome UK. I have Fowler syndrome myself, and we've been talking lots about the stigma around anxiety and Fowler syndrome, and it's really interesting because, as I was saying, when I first saw a doctor, when I first went into retention a few years ago, the first thing that was said to me was, are you sure you're not just anxious, and go away and do some yoga and wellness and you'll be fine in a few weeks. So it's such a balance, isn't it? Because I know there is a huge amount of people with Fowler syndrome that also have anxiety, but also equally there's a lot of people that get instantly dismissed as just being anxious and almost being made to feel like there isn't anything physical going on. But I completely agree with you, and there is no shame in speaking to a therapist or a psychologist. It's something that I would highly recommend, and I think it's so important to do because you need the extra support. You're dealing with Fowler syndrome and there's a lot going on, so it would be amazing to get some extra support with that.
Thanks. Yeah, I'm really sorry to hear about your experiences, but I think it is quite common actually. So just to clarify a little bit, and I'll just say a little bit more about that now. Because as you were saying earlier, there's a sort of distinction between somebody who has Fowler's and is trying to sort of live with Fowler's and cope with it and manage it, and perhaps people who have psychological or psychiatric comorbidities and who perhaps need some treatment for that or for those comorbidities as well. And so part of our work is sort of trying to sort of unpack and disentangle, if you like, the different sort of symptoms and presentations and to work out what is going on. And in one of our future sessions, we'll be talking a little bit about what are the options. And so just to give one example, people have been working with a modality called cognitive behaviour therapy, CBT, and in one of our future sessions we're going to be able to talk you through what that is and how it can help.
So I would say I'm really lucky in the sense that I don't suffer with too much anxiety. However, since being diagnosed with Fowler syndrome, there are definitely quite a few anxious thoughts that I have, and I would say maybe the number one thing that I have is anxiety around being in social settings. So for me, arriving somewhere and needing to go often, and I definitely spend longer in the loo than the sort of average person that doesn't have Fowler syndrome does. So that's definitely an anxious thought that I can sometimes overthink and drive myself a little bit insane about. So how might psychotherapy help those kind of thoughts?
That's a really interesting example. Thanks for sharing that. I'm going to show you a diagram here on my computer, which I just happen to have, which will partly answer the question. Okay, so what I happen to have on my computer here is what is sometimes known as the cognitive behaviour therapy hot cross bun diagram. And I should just say, I'm going to sort of talk us through it in a moment, but just to kind of say that there are lots of different kinds of psychotherapy modalities, and one of those is
cognitive behaviour therapy, and this diagram comes from cognitive behaviour therapy, but there are other types of therapy that might be useful for different reasons, and maybe we'll come back to talk about those some other time. But let's just hold on to the thought that we were just hearing about earlier. So very typically the diagram as it shows will show how our thoughts, emotions, physical sensations and behaviour are very much linked and intertwined, and as you can see by the arrows, they can go sort of in any direction and crisscross. So let's just take the thought that we heard just a moment ago, and it's the thought which is something around, I'm spending a lot of time in the toilet, I wonder whether people notice that, are aware of that, and do they perhaps think less of me in some way because of that. And this could lead to all kinds of emotions, for example, embarrassment, even maybe shame, perhaps low mood, and that may lead to physical sensations, which in anxiety may be feeling a knot in the stomach or sort of sweaty palms or heart racing. However, in Fowler syndrome, it's perhaps even more interesting in that here in this part of the diagram, there may even be another mini loop going on, because if somebody is perhaps anxious about going to the toilet, they may be holding on for a little bit longer, and then that can lead to other physical sensations, such as now I really need to go desperately, and even to the point that but now I can't go and I've held on too long, and there's sort of additional shame and embarrassment. So there may even be a little mini loop within the loop going on here in the diagram. And then as we go around to this other part of the diagram, we go around to behaviour and what may be an example of their behaviour, and often in anxiety it will be some kind of avoidance. And so of course with Fowler's syndrome there may be even an avoidance of going out, going to social events, and just that fear that people are going to notice me, going to notice what I'm doing, going to notice the time I spend in the toilet, may actually result in people not even going out at all. And then of course, as you can imagine, this whole cycle starts spiraling, because then there could be the thoughts, oh, my life is so terrible, I can't go out anymore, I'm losing my friends, I'm not seeing any friends, I'm stuck at home, and that can lead to other emotions, depression, anxiety, etc. And so the whole cycle starts up again and spirals. So that is just one tiny snippet of an example of how you can work through with a therapist.
That was so interesting, Caroline. Thank you so much for talking us through that. So in my example, what would be the next step? What would you suggest I do next?
So once you've sort of identified this sort of cycle, these circles of thoughts, emotions, physical sensations and behaviour, the next step, or one of the next steps, is to work with a therapist to actually challenge those unhelpful thoughts. So it's a really important first step to actually acknowledge the negative automatic thoughts, or the thoughts that are going through. And many people find that in itself actually quite helpful, because they say, goodness, I wasn't actually kind of really aware of what thoughts were going through my mind, and that's actually been quite an interesting exercise to realise. But then, given that, you know, there may be some unhelpful thoughts going there, the next step is to challenge those thoughts and to ask, in brief, typically, what is the evidence that you have for those thoughts? So people will typically say, you know, I have the worry that other people are noticing that I'm spending a long time in the toilet, or I have the belief that other people are thinking less of me, or laughing behind my back, or whatever it is. So it's really about saying, well, what is the evidence? Can we challenge that thought, and can we come up with perhaps a more helpful thought? And just to give two examples today of how we might do that. So first of all, it's literally challenging the person to come up with their own ideas about how realistic the thought is. So first of all, are other people in the party or the dinner party going to be noticing how long you spend in the toilet? Are they really looking at that, or are they perhaps engaged in other conversations? But even if they did notice, are they going to have negative thoughts about that? So already you can start to sort of try and put yourself in somebody else's mind, somebody else's place,
and to think, well, do you know what, I think people are going to be thinking about their own life and enjoying the party, perhaps they're not even noticing me. And the second thing is to actually go beyond that. If you're not sure, you can actually do, for example, a little survey in cognitive behaviour therapy. So you might think, well, what evidence do I have that people are thinking X, or that they might have these thoughts about me? So you could even do a mini survey and say to people around your dinner table or at your party, you know, first of all, did you notice how long I spend in the toilet? You know, possibly not. And even if it did seem a little bit longer, what would you think about that? You know, is it the case that you would actually, you know, think less of me? And you may be surprised to find, most probably be surprised to find that a lot of people didn't really notice. And even if they did, they certainly didn't think ill of you for that. So it's really, the whole process is really about sort of challenging unhelpful thoughts.